Cervical cancer is the second most common cancer among women aged 15 to 44 years in the country, and it is a pressing public health concern, with India accounting for highest number of cases and highest number of deaths globally. The 2024 health budget of the Government of India prioritized the HPV vaccination for girls aged 9 to 14, aligning with the WHO's recommendation as a cost-effective measure against cervical cancer. Joining us today to share insights on India's HPV vaccine rollout strategy, the vision, challenges, opportunities, and next steps in India's fight against cervical cancer, we're joined by Dr. V.K. Paul, member NITI Aayog. Thank you so much, sir, for joining us today. I think to begin with, as a key architect in India's immunization programs, I want to ask you if you can tell us the status of the HPV vaccine integration into India's national immunization program and what really is planned for the phase of the rollout of the vaccine.
Well, as you're aware, the introduction of HPV vaccine to prevent cancer cervix, the primary prevention of cancer cervix, this commitment was given in the budget speech by the Honorable Finance Minister. The government is working in planning it out, planning a detailed implementation of rollout of the HPV vaccine. Technical details as well as practical details, practical strategy is being worked out.
Sure.
And indeed, as you very correctly said, it is a very, very high priority cancer. It's a cancer which afflicts poor women in particular. It doesn't spare anybody, but it so happens that epidemiologically, the less privileged women of our nation get affected by this. And we know that it is amenable to vaccination. It is also amenable to secondary prevention, which means early detection and effective treatment. Our fight for cancer cervix should be supported by all stakeholders. And it is indeed time that this disease is controlled. It is not acceptable that more than 70,000 lives are lost to cancer. It's not acceptable that a high incidence, relatively high incidence compared to other cancers and other chronic disorders continues unabated, because we have the intervention, we also have primary prevention, as I said, but also equally importantly for secondary prevention, which means screening, and I'll be happy to elaborate on that. And of course, we are also striving hard to improve the diagnostic so that the detection can become efficient, affordable, and scalable.
You know what you rightly said, it's not acceptable. And the figures, are really, one woman every minute dies in India because of cervical cancer. And today, all day, we've been talking, together against HPV, the fight against cervical cancer. Dr. Paul, you said about prevention. The Honorable Prime Minister also talks about preventive rather than curative. So talking about cervical cancer, your thoughts on that?
Well, in the space of preventing cancers, fortunately, cancer cervix in a very big measure is amenable to prevention. But I also want to mention that the liver cancer, which is often caused, at least a significant proportion of that is caused by hepatitis B and other viruses, is also amenable to prevention. So we're fortunate that today we have interventions which can offer us primary prevention for as significant a disease as cancers. But having said that, I would like to share thoughts with you, to say that there are other aspects that we must keep in mind in our fight for cancer cervix. First, the technical aspects. One is that when we will introduce vaccination, HPV vaccine, for our adolescent girls, please remember that cohort will be protected.
Yes.
But what about the cohort of those who are already infected and have a predilection for cancer cervix? For that, we have a very well-tested strategy of early detection of cancer cervix. Between the age of 30 to 59, every 5 years, there has been a long-standing strategy of doing a pap smear and picking up precancerous and cancer-like situation Uh, People who have more access to hospitals have always been using it. We also have in the primary care system a visual inspection and acetic acid method of detecting precancerous lesions, and that's scalable. And also a moving toward more efficient point-of-care diagnosis using HPV DNA technology, and it's only a matter of time, as you may have heard already. The point that I'm making is that, yes, one part of our strategy is primary prevention, scale up the HPV vaccine, and as I said, the action, preparation, and the strategy for that is being contemplated, being crystallized, and so on. But let's not forget that the cohort which has not received the vaccine, and that's the cohort we should be worried about them, because they are going to get cancer in the age when it gets manifested, typically between 30 to 60 years of age. And for that, the system that nation has created is through health and wellness centers, the Ayushman Arogya Mandirs. One of the critical activities is to be able to screen women every 5 years using the approaches that I mentioned, primarily the VIA, and hopefully soon enough using HPV DNA technology. In addition, these screenings are also available in our other hospitals. And of course, they are accessible through the private sector for a long time and at more advanced institutions. I want us to remember that approach of so-called secondary prevention, that means you detect early so that the adverse effects, the serious situation is averted, and the cancer is detected at a point when, for all practical purposes, it is treatable, fully treatable.
So clearly, I mean, screening is important. Once it's detected,
Indeed.
early prevention, I mean, it's easier. So if I could just request you to put your mic a little closer.
Sure. So the point is that between the age of 30 to 59 is every woman receiving screening for cancer cervix. That's one goal that we must achieve. And the goal through our primary care system can be achieved. This goal can be achieved through our primary healthcare system. 175,000 health and wellness centers have been established. The SOPs to conduct that kind of a screening has been rolled out, and we would like to see participation of the professions and other stakeholders to take it out to scale. But nonetheless, in the medical colleges and other institutions and even good district hospitals, such a screening has been possible even earlier on.
When you say, of course, I mean, we know prevention, right? And then it's screening, early diagnosis, treatment, awareness. Do you still think there's a gap? And very often one is aware, one knows they need to go to the doctor, get a checkup, but the action is delayed. How can we bring about that change?
Demand. We should spread the word so that we ask for timely screening and, of course, timely vaccination. That's something that should be known to everybody. And the age at which this should be known and I should feel responsible for is the age after 30 years of age, 30 years, okay? We must also emphasize that once this cancer is detected, it's covered under Pradhan Mantri Jan Arogya Yojana. Ayushman Bharat, PMJ, covers this condition. Cashless treatment of this cancer is mandated for all the beneficiaries of PMJ, and these are 55 crore individuals. And then the state governments have their own top-ups on top of this base number of 55 crore. And when you look at it, half of India's women have access to cashless, free cancer treatment for cancer cervix.
I think that's a very important point, which again, there's not much awareness about. NITI Aayog clearly works, I mean, as a think tank. And we've seen many states have rolled out the vaccine. There's Sikkim, there's Bihar. But if I can ask you as a strategy, because that's what we're talking about, any lessons that you would like to share which some states have done, not just vaccination, but just generally where prevention, how they're dealing with cervical cancer?
States have demonstrated, let's say, two things. One, that it is possible to scale up HPV vaccine in a systematic, safe manner, but more importantly, they have also surmounted and found ways of addressing the concerns that come up when such a strategy, is truly rolled out, because people have questions, people have misconceptions. At times there is misinformation, infodemic that we've experienced from time to time. So the states have learned, how to technically and for execution, they found the pathways to do it. So the learnings are available in that aspect. But more importantly, when you do it, we should not succumb to undue concerns which do not exist. We should be clear about the, quote unquote, side effects, if any. And also, we should have confidence in the minds of people that this is something for their good,
Yes.
this is trustworthy, this is based on science, it is safe, and it is in the larger interest of the people.
And what would you say, since you said, science, how do you think we should be leveraging technology
Indeed.
when it comes to healthcare?
Very much so, because the efficacy of these vaccines has been demonstrated in the world, and it has been demonstrated in our own studies. And therefore, yes, it is based on science, and that's why the commitment has been made by the government. And also through the experiences in the state, as well as through our own scale-up studies, we know how to take it to high-quality coverage across the beneficiary group. My message is that we should visualize India where cervical cancer has been eliminated. We should work on both the strategies of primary prevention. At the same time, let's not forget that there is a large cohort of our women citizens who have not received the vaccine and are vulnerable. My message to them is, and message to the health system is, that make sure that these women are subjected to timely screening, systematic, accurate screening, confirmation of diagnosis,
Yes.
and then put them into the treatment pathways for which the government has hand-holding and financial coverage system that are available.
I think very, very important messaging. Just a question on, there can never be one-size-fits approach, especially in a country like ours. How does one create community-based approaches to reach our diverse populations, whether it's the geographical location, cultural, socio-economic? I mean, we have a lot of that in our country.
Well, first and foremost, nation has a footprint across its geography.
Yes.
We have seen this in the wake of COVID-19. We see it on a daily basis through the success of our universal immunization program and more. So we have the network. We have the primary healthcare center, the health and wellness center, the Ayushman Arogya Mandirs, in very, very large number, close to people, looking after about 6,000 to 8,000 population, that level. We have outreach workers who are force multipliers, and they're connected with the community, the ASHA workers and ANMs. That workforce is available, which is unique to our nation. At the same time, we have digital systems which allow us to take technologies to the nook and corner. And this particularly applies to immunization program. The nation runs the biggest immunization program in the world. And we could scale up the COVID-19 vaccination program of 220 crore doses because we had the learnings and the foundation and the fabric of universal immunization program. Time has come that we use those capabilities, that experience, that strength, and then take it to scale, both from vaccination point of view as well as screening point of view. But we also not forget that we have a huge base of producing vaccines.
Yes.
We are the vaccine maker of the world,
yes,
for the world. And therefore, we are in a very unique position of having access to vaccines, our own vaccines. We are in a unique position of a strong primary healthcare system which has mastered delivery of universal immunization program. We have the new energies and new infrastructure in the form of Ayushman Arogya Mandirs. We have new opportunities through Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which assures free, cashless treatment all the way, end-to-end treatment of most of our women who would harbor this disease. And therefore, When all these things have come in place, as society, all stakeholders, media included, should come together
Yes.
to act on all the points.
All the parameters.
All the way. For example, allay the anxiety with regard to screening. Create pathways of hand-holding those who are diagnosed with this illness. They need support of a different kind. They have questions in their own mind. Society also has to join hands with the government, with the providers, to be able to deliver services and to eliminate a cancer which has no place in today's time to be afflicting our citizens.
I think that's really well put. Everybody needs to come together, work together, all the stakeholders in this fight against cervical cancer. You spoke about the ASHA workers. They've been with us. They've been interacting. They've been telling how they've been trained. It's really a pleasure to have you with us on NDTV. Thank you so much for joining us.
Thank you. Honor to be here. Thank you.